Welcome to We Need to Talk, the podcast that features a series of conversations aimed at shedding light on issues surrounding women. I am your host, Klean, and this is a space where women can discuss the issues we've been forced to barely whisper. As women, we know we need to talk means things are at a point where they must be addressed now. So join us as we tackle conversations that are necessary, even if they make you slightly uncomfortable. Hi, and welcome back to another episode of We Need to Talk. This week, we're going to just jump right into it. It is part 2 to last week's episode. We have with us again Dr. Matthews and Nurse Myers. And we're going to continue the conversation that we started last week. We are looking at sexual and reproductive health, but this week, I'm going to be asking some of the questions that you've submitted over the past couple of weeks to our social media pages. Some of you came up and you said, I really want to know X, Y, and Z. So today we're going to do a little rapid fire style, go through some of these questions really quickly. So it's more question and answer today than conversation that we had last week, which was really good. I really enjoyed that conversation, very informative. Looking forward to more of those conversations. But for today, really doing some rapid fire questions. Before we start, though, I think I just want to take a moment and pay tribute to someone who was a champion for HIV and AIDS and awareness here in Anguilla. That is the late Mr. John C. Lake, better known to most of us as POW. There's no way that we can have these types of conversations without invoking his memory and thinking about all the work that he did to raise awareness on this topic. So just really want to take a moment and just remember him and remember the work that he did, and hope that within each of us that we can continue that work and continue to raise awareness. So on that note, let's jump right in because we need to talk. Dr. Matthews, Nurse Myers, thank you so much for joining me again and for coming back so that we can have not just this conversation, but to answer these questions. I know these are literally some burning questions that persons want answered. So thank you so much. So I'm going to refer to the questions that were submitted, and let's see how many of them we can get through today. If not, we come back and we do this again at some point. So let's begin. In the last episode, we spoke a bit about STIs and STDs. So I think it's only fitting that we start with some of those questions. And again, just so persons know, these questions were submitted to us and we're going to address them. So, first question, can STIs be transmitted through oral sex?
Yes, they can.
Yeah. Okay. Another STI, STD question, are drugs like PrEP available in Anguilla?
I believe, yes, they are. It is good to speak with Dr. Hodge, I believe. She is the coordinator when it comes to the doctor aspect of those prophylaxis drugs for HIV. So I do think it is here in Anguilla.
Okay, so for persons listening, can you explain just a little bit what drugs like PrEP are and what do they do?
Okay, so PrEP is basically pre-exposure prophylaxis to HIV. So it's like you take this drug, it helps to prevent HIV once person get in contact with somebody. So you take it, as I said, as a prophylaxis. And when you hear about prophylaxis, is you preventing the disease. So somebody, you take the drugs, you have sexual intercourse, unprotected sexual intercourse with somebody who has the disease. This drug is going to prevent you from developing that disease.
Okay. So it's something that's probably used in couples where maybe one partner, even long-term couples, where one partner is known and their status is known to be HIV positive.
Yes,
Okay.
yes, that can be used.
Okay. Speaking about, just veering a little bit from some of the questions, speaking about HIV and AIDS, I know last time we really spoke about going and getting checked, but I want us to kind of expound a little bit about knowing your status and why that's so important.
So we do recommend for couples, say for instance, you're a young lady or a young gentleman, you meet this person now, you are going out a couple times and then you're thinking about engaging in sexual contact. So it would be recommended that both be tested to see if there is any evidence of not just HIV, but other kinds of transmissible diseases. Because, you know, sometimes persons would come to me and they would say, Doc, you know, I met this gentleman and we had an encounter, and then a week after, 2 weeks after, I'm noticing this sore on my vagina, or it's itching or it's burning, and you know, and when I examine her, I might say, okay, this looks like herpes or anything else. You know, HIV, you would not pick up immediately after. Herpes would be something that you'll pick up if it's transmitted to you within a reasonable time. But it would be good that once you decide to engage in sexual contact, you need to know the person's history. And then sometimes if a woman comes in and says, but Doc, I never had this before, she would find it difficult to discuss with the gentleman, did you have this before? Or, you know, that kind of a thing. So sometimes I am like the mediator to kind of explain what it is, what it means. And herpes is one of those diseases that you could have had from some time before, and then you transmit it to somebody else. Sometimes it's transmitted even when you don't have an outbreak. Right, so you can have aviral transmission. So the person might say, oh, I don't have an outbreak, so it's okay for me to, you know, have relations. But then they did not disclose that they had it. And then the female might feel, oh, did I give it to this person? And then, so she's asking me, you know, how is she going to know and whatever. So many times I have been the mediator to bring the couple together and try to explain as best as possible how it's transmitted, the length of time that it may stay in the body. And herpes is one of those infections that you don't cure it. You can treat it. So that will always be in your body. It has a dormant period where you might not have an outbreak. And then under periods of high stress for females during our menstrual cycle, sometimes that can bring it about. Increased exposure to sunlight can bring it out to bring out an outbreak. And of course, you have genital herpes and you have oral herpes, the one that is on the mouth and then the one that's on the genitals. Most little children you will see with the ones on the mouth, but the ones on the genitals says herpes 1 and herpes 2.
And let me just add here that when you're looking at couples and getting tested, I think once you do it together, it brings a sense of trust. You know, let us do it together. Let us find out our status together. And just for information's sake for the public, HIV testing is done at Western Polyclinic, free of charge, and it's confidential. Now, the test that we do at Western Polyclinic is a rapid test. So once you do that test, you get it back in like 15 minutes, the whole process. Well, after, you know, the counseling and somebody test itself, like 15 minutes. Once somebody is positive, then we send you now for
confirmatory.
Yes. So then we send you to the lab to put some blood just to confirm, right? And from the last episode, remember we talking about that 3 month period, we call the window period. So even though somebody come and they get tested and it's negative, we still encourage them, still use protection. You know, you still have that 3-month period, so you come back another 3 months for us to retest. But during that 3 months before you come back, still use your precaution because you want to maintain that negative status, right? So that is just for the public to know that it is done at Western Polyclinic.
And even for hospital workers, you know, sometimes you get a needle stick injury. So then, as an intern, I remember I had, it was a belligerent patient and they were fussing and fighting and the needle actually stuck me. Ooh. So then the patient had to be tested for HIV and all the diseases. I had to be tested myself, receive treatment, and then thereafter, within a 3-month period, I had to get tested again to make sure. So there's a protocol for hospital workers if we do get an accidental injury that, you know, we have to go through the process as well. That's for our protection as well as for the patient as well, to make sure that we are both negative.
Right. I think over the years, with as the advent of drugs for HIV and persons being able to live longer with HIV and AIDS, and we don't necessarily hear as much about it now as before. Do you think there's some sort of complacency when it comes to persons and engaging in sexual behavior with maybe multiple partners, not necessarily knowing their status? Is that something that you're seeing like on the rise in persons coming in to the clinics? And
I think for me, a lot of females would come in to get tested. They want to know their status. And sometimes when we said, okay, what about your partner? Sometimes the male counterpart may be reluctant to come in. And we also have, you know, superstars, Magic Johnson, you know, they're like, oh, he has HIV/AIDS and he's looking nice and fat and plump and juicy. So persons are like, you know, in the beginning when we were just learning about HIV and AIDS, they'll be like, you have to be a homosexual. No, you don't have to be a homosexual, because at first it was portrayed as being a homosexual disease. And it is not. It can be transmitted man to man, woman to woman, and all of that. So we still, as medical professionals, commit to educating persons as through even this medium. So yes, persons, it's not a death sentence anymore, because now that we have learned about it, know prevention and have the medications, persons are living longer and living healthier lives. I would want to see the uptake of testing, especially as you said, couples testing, to be more. But I think with avenues like this, when we discuss it, it might bring in more couples to come in, because sometimes when a female comes in, I would say, you know, you can bring your partner. I can speak to the partner. Or sometimes she would say, well, maybe he doesn't really want to come into you, but I would write the form and say, okay, well, he can still go and do the test. You know, if it comes back positive or something, then I would counsel and then we move further from that. But I do feel like a lot of the females are coming, and especially when they're pregnant, because we do opportunistic screening at that point in time. Because once you're coming and you're pregnant, you have your antenatal screen, which includes your HIV, your syphilis, your hepatitis, and so on. So if that is positive, then we have to test the partner, and we do contact tracing as well. So if you said, well, you're with Mary Jane and Sue or this person, then we have to try to contact those persons to make sure we test them as well.
Okay. Do you find persons are very open and honest about their contact partners during that contact tracing?
Well, once it's something that is as important as this, sometimes they are not as forthcoming, but with counseling, because they said, you know, it is important for the other person to know, so that they can be tested. They might be negative or, you know, whatever, but it's important for them to know. I mean, just like if I get a needle stick injury, I have to know if the person that, if I was drawing their blood or something, I have to know if you're negative or positive, and then for myself as well as a doctor. So I think that awareness is on the rise because persons are very hush hush about, HIV status because it carries a negative connotation
right.
with it. So persons don't want to know. But I have met few persons that are positive and are open and try to educate other persons, young persons as well. And Mr. Lake, as you mentioned earlier,
Yes.
he was
Yes.
an advocate for
Yes.
HIV/AIDS and also for prostate cancer.
Yes.
And I remember the first time I met him, and he just came right out and said, this is that, prostate cancer, and, I am on a mission to educate persons so you don't follow in my footsteps.
Yes.
And he was always on the go, always doing something, always promoting something.
Yes.
If we had the breast cancer walk, if we had the prostate cancer, and I would go to the cancer meetings, the ACAN meetings and all that. So I really respected him as somebody who was forthright and just went and said, I have this and I have this, and this is how I've been living with it, this is how I've been managing it, and this is how the youth can prevent yourself from getting into following in my footsteps.
Yes, I had the pleasure of interviewing Mr. Lake on another program, and it stuck with me how open he was and his advocacy. There's a question. Are there different types of orgasms and how are they achieved? Are orgasms the goal? I'm going to add this. Are orgasms the goal of sexual intercourse?
Orgasm is real. I know a lot of persons may never really experience a true orgasm, but orgasm is just like, for a female, is like ejaculation for a male. Right? You reach that high, that pinnacle, as we want to say, that climax, right?
Okay.
Yes, it is real. It can be achieved. However, I always tell persons that we have to look at men and women differently in terms of, I like to use this, what I would like to say, expression that men, they are like light bulbs. You put them on and they're just ready to go. Women now, we are like irons. You put on an iron and you have to take a little time for the iron to
heat up.
So to really accomplish orgasm, sometimes you have to do a lot of foreplay. So your partner, your male partner, have to be able to do that foreplay, get you in that mood, know the position also. Know the position, yes. And then, you get that orgasm. But it's real, it's fun, it's good. As I said, it's just ask a man how they feel when they reach that point. So yes, that is my take on it.
Okay. Dr. Matthews?
Yes, I agree. So a man is more ready to go, sometimes more visual. He can see a woman with a nice big bottom, a nice big boomsy. He ready to go. Yes. And then, an erection and so on. A female now, she might want to be played with, kissed. Some females like to be kissed on the neck, on the lips, the breasts, and all of those things. So I agree with your analogy. The female needs more time to kind of warm up to get to that position. In terms of an orgasm, yes, I would agree also with the climax, similar to men ejaculating and reaching that point. For females, you have what they call clitoral orgasm. So females would say if they masturbate and they use what is that thing now? The rose?
The rose.
Or something like that. And, it's on the clitoris, and so when that gets engorged and so on, they have a clitoral fulfillment. And then you have persons that have penetrative orgasm, which sometimes may be more difficult to achieve. Yes. So clitoral stimulation or clitoral ejaculation is more easily achieved. And then, as you said, it also depends on the positioning that you're in. So for the females, if you're on the top, if you're on top of the male, you're kind of controlling the rhythm and so on and how fast you go. If the man is on top, maybe he's like he's in his groove, so he's, you know, going against your groove. So it depends on that. And, you know, some women like different positions. Everybody is different. So it's for the couple to know what they like and mesh, because sometimes if I may be with this person, I'm like, oh, I don't really like that, and then I'm with somebody else and they're like, oh, you get me. So if you're in a relationship, pay attention to your partner. So I'm speaking both to men and women. You have to pay attention to your partner to know how to please your partner, for both of you to achieve an orgasm.
Communication, conversation.
Yes.
How important is that to knowing? Because I know sometimes persons may feel a little bit shy, like, oh, you should just automatically know what works for me. Communication.
Yes. Communication is as important or even more important than the act itself. Because, you know, when you start off, you're not really sure, so you kind of gauge in the waters to see, you know, she like this, she like that, he like this, he like that, whatever disposition. And what your ex-partner likes may not be the same thing that your new current partner likes. So, you know, it's not a one
size fit all.
No, it's so communication is very important. And I know sometimes it's a kind of awkward conversation because, you know, you don't want you to be like feeling, oh my God, I did it. And then he's going to say, I didn't really like that. It could be a little bit of an awkward situation, and everybody is different, you know, so talking is important. And, you know, you can do it in a nice, fun way. You have games that you can play, you know. You can go to these stores and you have like sex games that you can play to say, you know, you do this, you do that, you like this, you like that. Not that I've played any of them, of course. So, you know, sometimes you can, suppose I'm saying, oh, I'm not really sure what he like, but I'm not sure how to introduce a conversation. But, you know, you have these little books, these little games and all these things. So, you know, you can play something
you can play 20 questions.
And try to figure out each other's weak spots and so on.
Okay. So we spoke a little bit about clitoral stimulation and penetrative stimulation. There's a question. Is the G-spot real? From a clinical standpoint, is the G-spot something that exists?
Well, to be honest, yes, it is. And the thing is that G-spot, sometimes it may be difficult to reach. As was said, you know, you have to be in a position to reach that spot. So not everybody really will get that sensation because they didn't reach it, you know. The penis have to be rubbing against it, and it's really, if I could remember correctly, doctor, you can correct me, it's just what can I say? When you enter into your vault or your vagina, it's just up forward.
Understand that it is completely uncensored because this is for educational purposes. Yes. And I think if you're going to be having sex, you should at least enjoy it. For educational purposes, please feel free to demonstrate.
So as I said, yes, it's up forward. So in a position where the woman is on top, it's easier for you to reach that position, reach that spot there. So maybe you could try, ladies, you can try it. Down.
So it's in and upwards.
Yes.
Okay.
So remember the vagina, the clitoris has a lot of sensory tissue, right? And erectile tissue. So it's, remember, when you are just a little peanut in your mother's womb, you know, we all start off the same, and then you differentiate into male or female. So the genitalia basically starts from the same thing, and then we differentiate. So it's basically almost the same kind of tissue. So when you stimulate the clitoris, those erectile tissue, similar to the penis, it becomes enlarged and engorged and all of that. Even on the vulva itself, the lips of the vagina. So all of that is sensory tissue. So once you get stimulated, all of that is stimulated. So it comes in a culmination of all of that. And then when you enter now and you do to that area, the G-spot, then that is the pinnacle of everything. You know, but
so is that like the internal mechanism of the clitoris? Is it like connected inside and outside?
I will not necessarily say connected, but the genitalia has erectile tissue and sensory erectile tissue. So if you are masturbating and you're playing with your clitoris, if you observe, it will become more erect and it becomes engorged, so it becomes bigger, and even the lips of the vagina becomes bigger as well, and that opens up the vagina for the entrance of the penis to come in. So everything is a beautiful dance for sexual intercourse between the man and the woman. And the male genitalia and the female genitalia go hand in hand together to get that beautiful dance going. So yes, the erectile tissue and all of that. So, and for some women, their clitoris may be a little bit bigger than normal. It doesn't mean that they are more male-like necessarily, but some women may have a very small vagina. The lips might be very covered and, very, in. And then you have other ladies that have a more bigger mons pubis, bigger vagina and so on. So they have more erectile tissue and so on. So everybody is different, but essentially we're basically all the same, just a little bit different.
So just as we look on the outside,
right?
Yes.
It could be that different.
Yes. So we come in different shades and sizes.
Exactly.
So too, it carries downwards.
Exactly.
Okay. Before we started, we had a little bit of a discussion on this, and we know those old wives' tales and those tales that was told to us. If you masturbate too much, you may turn blind.
Yes.
Is that fact? Is that myth?
Well, I think if that was a fact, we have a lot of blind people. Swallow bubble gum, you're going to tie up your tripod and all that. If you swallow seeds, you're going to grow a tree inside. I think exploring your sexuality when you come into being a teenager or adolescent, it's quite normal. But for me now, in 2024, versus when I was a teenager, it's much different. Because I did not have a cell phone when I was a teenager. I did not have. I'm that old, yes. Even though I don't look it.
Me too. Yeah,
but I didn't have those things. Google. What is Google? And I remember the first time I went to my friend's house. We had a group study. We were studying for maybe CXC or something. And we're on a study break now. And they're like, "Oh, we're gonna watch a special movie." I've never seen that before. And that was the first ever time when I saw porn. And maybe I was about 15 years old. And nowadays, it takes just a click on your phone and you can go to a pornographic website. You can be hooked up with a sexual predator or something like that on the internet. So in my days, it was much different. But nowadays, adolescents and teenagers, I think they're exploring their sexuality much more now than back in my days. And this thing about, they want to be identified as they, them, and this, and they're man going to be a woman, and woman want to be a man, and transgenderism and all those things, that wasn't as popular when I was younger as it is now. And given the freedom to do that. I believe in adequate knowledge and all of that. But sometimes I believe that, for the younger persons, too much information can lead to going down the wrong road. But masturbation in and of itself, to me, is not a bad thing. Persons say you can get addicted to it. You can get addicted to pornographic websites, and that can lead to mental disturbances and cause you to do, adverse activities. So, I would just say everything kind of in moderation. Yeah. So you don't want to overdo everything. But I do believe that in this day and age, 2024, when, when my niece and nephews were like, 5, 6, and I went to visit them, and they're like, "Auntie, what's your password for your phone?" and because they want to play games or whatever. I mean, when I was 5 and 6, I don't know what password was for phones and all of these things. So, you know, all this information is more easily at the fingertips. And then when they go to school and they see the classmates, and if that one doesn't have a household that is honing in on those things, they can easily be, you know, distracted and influenced with those kinds of things. So I think that for adults who know how to manage all of these things, masturbation is not a problem. For the younger children, for adolescents, you have to be aware and beware of those things. And when you want to indulge in sexual activity. So sometimes I have somebody who is 15 or 16 years old coming to me for contraceptives because their boyfriend want to have sex now and this and that, and it's a slippery slope. Because then if you don't use protection, you have risk of pregnancy, you have risk of STIs, STDs, and all of those things. And then one wrong move can lead you down a path that some persons may never recover from.
Yep. Let's stick to masturbation a little bit, just a little bit more. And we're going to move. I'm very appreciative that you spoke about the adolescent side of it, because yes, there is an exploration of our bodies as we become more aware and want to know what our bodies do. Earlier when we were speaking, we spoke about how can we expect our partners to know what we like if we ourselves don't know. If you know what you like, you can better communicate that to a partner. Masturbation, I think, and you spoke about back when, you know, the rules and the introduction of toys.
Right.
Again, healthy ways to do this to ensure that if you're going to be introducing toys, is there a healthy way to do that? And again, as from an adult standpoint, not speaking adolescents and teens.
I mean, once you have an adult relationship, if you...
No, even as a single person, just masturbation.
Or in a relationship, you can do that. And as you said, if I don't know what pleases me, how am I going to communicate to you what pleases me? So a lot of ladies now, for me, are more open in coming to say, oh, yes, I have my rose. Yes, man, I have the pink one. I have this one. And, you know, they have all these kinds of things. So they are not shy in saying what they do to me. Well, not what they do to me, but they will, you know, say, you know, they like this and, you know, that. And sometimes they will say, you know, my partner. I said, but if you know, maybe you can introduce that with your partner then. And then he may then know what is going on. I would always tell persons, you know, if they're using a toy, whether it be, because, you know, sometimes girl on girl uses toys and whatever. And I would tell them, you know, well, you still have to keep the toys clean. You don't just finish use it and throw it in the corner and then you use it again. You have to wash it just like how you would wash your genitalia. So because it's being inserted or whatever it's being done. So you have to wash it and make sure it's clean so that you don't have any transmission of any kind of infection where that is concerned. But I do find now that women are more open to discuss what they do in the privacy of their own home when they are there. And I do encourage them, if you're lacking with your male partner, you can try to introduce that for him to know what you like.
Okay. We spoke about orgasms, we spoke about toys, we spoke about the G-spot. They want to know about squirting. Is squirting real? Is it ejaculation fluid? Is it urine? Is it a combination? What is it?
Okay, so I don't know about this one, so doctor. I've seen videos of persons squirting, and I myself have to wonder, because it's like, shh, and you wonder, where is all that fluid stored?
Yeah.
Where is it coming from?
To be honest, I am not too sure about that one. I always wondered myself.
For me, like as you said, I will see the videos, and when you look at the videos, you see a gush of fluid, more than a gush because it's streaming. and it's quite liquidy.
Mhm.
So it's not like the fluid that you would
Fluid, yes,
expect
when you have a
coming
plasma.
from that. It looks more like urine to me.
Mhm.
So I would say it might be a mixture of urine and the fluid. That's what it looks like to me.
Okay.
So in my personal experience and what I think is happening, I would not. I have a question mark. I would say no.
Okay. Okay. So we're still not sure. It's a little still very
I
elusive
think it's more urine
than anything
fluid,
else.
yes.
Okay. Let's go to healthy practices for maintaining vaginal health. Top 3 are key issues to be able to maintain a healthy vaginal ecosystem.
So the thing is, doctor, you could add,
Yes.
the vagina comes with something we call a normal flora. It is basically there to protect the vagina from bacteria and other things that can lead to different infection. Now, I know a lot of times women will come and they said, nurse, I'm having an itching or having a discharge, and I will ask them, how do you clean your vagina? And they will say they will insert and wipe out and they will douche and all of that. And I tell them, no, what you are doing is that you are killing your normal flora, which is really there to protect, and you are inserting bacteria sometimes from your hands or whatever. So that's a no-no. It's a no-no. Well, when you look at it, you want to make sure that your normal flora doing what it's supposed to be doing. So don't feel, okay, I need to wash out this and I need to soap inside and do all those kind of things. No, you don't.
What is the right way?
The vagina is a self-cleaning
Cleaning.
mechanism,
Yes.
right? So inside the vagina, you don't need to. Some people say, oh, doc, I use Dettol. So they'll tell me they put the Dettol on the cloth and they insert and go. No, you don't need to do that with the vagina. You just need to wash the outside lips front to back. Just like when you pass urine and you're wiping, you go from front to back, so you don't introduce any bacteria coming from the back passage coming into the vagina, right? And douching disrupts the normal flora because the bacteria or the flora that we have is a balance between the good bacteria and bad bacteria that lives in a very harmonious situation.
Yes.
So once you introduce any of those other things, then the bad bacteria will overgrow the good bacteria, and then that's where you get an infection. So you can get a yeast infection, you can get a bacterial vaginosis, a bacterial infection, and all those things. And those may come with either itching, erythema, redness, burning. You can have a bad smelling discharge as well. It can be yellowish, greenish. It can smell fishy. Sometimes, the lady would come to me and said, but doctor, when I was intimate with my partner last night, he told me he could smell a little scent. So he suggested I come to get it checked out. So, sometimes the male is the one that picks it up rather than the female that picks it up. And usually it's a easy enough fix, but I will tell persons, and I'll ask them, do you douche? Do you insert rags with soaps and all those things? I said, all you need to do is wash on the outside. The inside will take care of itself. And remember, throughout your menstrual cycle, you have a normal vaginal discharge. So sometimes it might look more slimy like an egg white. Sometimes it's whitish, could be slightly creamish color. So the consistency may change. But usually I would ask, is there a bad smell? Is there itching? Is there burning? So once you don't have any of those things, usually it's your normal discharge. Which sometimes it can be a little bit more. Sometimes in pregnancy with the hormones, you could have a heavier discharge. So before I just go prescribing medication and antibiotics, I kind of delve into that to ask how it is. I notice sometimes, and this is just on my own observation. Some women will come to me and I would just make a point of duty to ask them, is your partner circumcised or uncircumcised? Because sometimes if the partner is uncircumcised and he does not cleanse himself properly by pulling back the skin and doing all of that, sometimes for me, from just my own personal observation with clients, I did not do a whole study on it, they tend to come to me with more infections. So I would just say, if you're going to be intimate, just tell him to wash. And, sometimes you don't want to tell somebody how to cleanse themselves. But if you're in such a relationship, then you can say, baby, you need to.
You also spoke about the normal discharge and that this discharge changes, throughout the month depending on where you are in the cycle. Are liners normal to use? Is it healthy to use them every day? Should you be using them every day? Just so so we know discharge can cause some discoloration sometimes in the underwear, and so persons wear liners to maintain the integrity of their fancy intimates.
Well, for day-to-day basis, you should not be wearing your fancy intimates like your silks and your laces and all of those things. You should be wearing cotton underwear, which gives your vagina space to breathe, and it's more healthy for the vagina. Of course, if you're having an intimate evening, you put on something nice and lacy or something, then that's fine. So my regular advice would be for ladies, wear your normal cotton underwear. Persons would ask and say, do I recommend wearing a G-string, or should it be like cover up all your bottom, because they figure if that little thing is going in your butt, maybe it's the thongs,
yes,
thongs or G-strings, yes. For me, I don't necessarily say not to wear it, but don't wear the lacy and the silk types that doesn't allow your vagina to breathe. And you don't necessarily have to wear it every single day of your life. I mean, if you're going out to a fancy place and it's a tight fitting dress and you don't want the VPL, the visible panty line, then you're gonna wear that so you don't see that. So my recommendation for liner, I don't recommend wearing liners every day. I think for most persons that wear liners every day, they come to me with more infections, because to me it keeps the vaginal area more moist than if you just have your regular cotton underwear. Right? If persons are active, so persons that go to the gym quite regularly, they go for an hour, they go swimming, I'd recommend, if you go swimming, you go to the gym, carry a change of clothes. If you go straight from the gym to work, carry a change of underwear, because you don't want that wetness to carry through the day. And I would tell persons, if you're an active person like that, pack two underwears in your bag, so when you finish, you put on a fresh pair of underwear. So I don't necessarily recommend wearing panty liners every day. When you're having your menses, and you wear that, but when the menses is finished, I wouldn't recommend it. And if you do wear tampons, because some persons prefer tampons than pads, then of course you have to change your tampons frequently depending on your flow and all that. So I recommend you always have tampons in your bag, and you change it at least 3 to 4 changes per day.
Okay, and just to add something to when we're talking about the whole hygiene and all of that, it is best for you to shave, because those pubic hair, and so it traps. It traps sweat, and sometimes you find you get this odor and all of that. So sometimes your underwear is wet because of that. So it is best to shave to get rid of those pubic hair to help to maintain a healthy vagina.
So do we recommend shaving over waxing, waxing over shaving?
I would say, for some ladies, when they come in, when they shave, they get the ingrown pubic hairs. If you're prone to that, I would say do the waxing. And then if you wax frequently, you know that the hair grows back and it's thinner, so it's easier. So it's gonna hurt the first time, but as you continue, it's going to get less and less. I would tell persons, I've had several persons come to me that have used Nair on their vajayjay. And I am not recommending nair to the vajayjay because some persons have like an allergic reaction. So the vagina swell up big. And yes, don't do that. Yes, so I've had several persons that have had such a bad reaction to it that they could barely walk into the office. Ooh. Right? They could not even sit down, right? And then they leave it on for so long, and they're like, oh, they wanted all the hair to be gone. So I don't recommend the nair. So if you shave, that's fine. If you don't get the ingrown hairs and whatever, that's fine. If not, go to a professional person for waxing. I'll tell you this story. One time, I'm a DIY person. If I see something on the internet, I'm like, okay, I'm gonna try that. I know how to do my nails, I know how to do acrylics, I know how to do my hair, I know how to do everything myself, right? So I saw this thing, you do the sugar wax, and they tell you how to mix it and this and all of that. And I was like, oh, that looks easy enough. And I did it and everything. Lord have mercy. Because when I made it, it was too hot. So then when I put it on myself, I burned, just a little. It's all in good shape now. It's all in good shape now. Okay. But yes, don't DIY. Go to a professional, I would recommend.
Who will not burn you.
Yes.
Pelvic floor exercises. Do they work?
They do help to strengthen the pelvic floor, and we recommend it for persons. They have the Kegels balls or the Kegels pellets that you insert in your vagina, differing sizes, and the sensation is like you need to pee, and it's like you're kind of holding it in, so you're tensing the muscles. And then to strengthen the pelvic floor, you can insert the different size balls depending on what your specific problem is.
Okay. What steps can be taken to ensure a healthy and fulfilling sex life as persons age? So whether women are going through menopause or, men getting older, what can they do to ensure that, they stay healthy and maintain that sex life as they get older?
Well, as you get older, and this is not a blanket statement for everybody, but sometimes women will come in and say, Doc, I don't even do that anymore, right? So if they come in to do their pap smear, they're like, Doc, there's cobwebs down there, nothing has been in there for 2-3 years or something like that. Sometimes their partner has passed, or sometimes they feel, oh, he with other women or something like that. So again, communication and being in a committed relationship and so on, because most persons still want intimacy, but it is that I find, especially in the Caribbean community, the men are a bit frisky, so the women just kind of keep to themselves. When they come in to get their yearly pap smears or every 2 years pap smears and so on, they'll say, oh, Doc, I don't do that anymore, whatever. He don't want that from me. I leave that to the young girls. Okay. And then I do have, on the other hand, some older couples that come in and said, yes, Doc, we're still good, we still do that. So again, it depends on the type of relationship that you have, the communication, are there any health issues? So sometimes if the man has diabetes, he may have erectile dysfunction and all those kinds of things. Sometimes the female might have fibroids, she's having pains, and all of these things are having bleeding problems. So again, it just depends on how it is, the medications that you're taking, if you have high blood pressure, if it interferes with your libido and all of that. So, it's not just one thing that we can spot to it, but a lot of men do have problems with diabetes. I remember this young gentleman came to me, young by young I mean maybe 40s, and I was just covering for the general doctor at that time, so I was seeing men and women, anybody. And when he came in, I was like, why this man look like he just next to, something not right. And, the person that came with him, I asked, does he do drugs, this, that, or whatever, because he was just so out of it. And I said, okay, I'm just going to order all the tests. And what she said to me was that he was normally a bigger person, and you just realize that even though he's eating, he's losing weight. And that is something that is of diabetes. And when I did his sugar test, it was through the roof. So I called him back the next day, and we started medication. I transferred him to internal medicine. And when I told him to come back in 2 weeks to see me, just for my follow-up, and when I saw that man walk through the door, it was a completely different man. So just 2 weeks of being on the medication and all of that, it was night and day difference. Because when he was in that state, he couldn't do nothing. He could barely even keep his head up. And he's like, Doc, I already conquered the world right now. You know, so just to check in for those kind of diseases in men and in women, you know, it can affect you. And sometimes with the medication that you take, it can affect your sex drive and all of that. So, you know, maintaining a healthy lifestyle is all around good for everything.
For everything. Good. So we're going to wrap up on this last question. And you sort of touched on it, but I don't want to assume what this person was saying, but because it is linked, I'm going to maybe do a little bit of an assumption. The question is, does drugs and alcohol affect libido? And so you've spoken just now about like prescription drugs for other diseases, but I'm going to make the assumption here that they're speaking about illicit drugs and alcohol and the effect that that have. And I'll say this. As a young person in Anguilla, and I've heard so many persons come up and go, you know, there's so many young guys that cannot hold an erection. And we know, and there's no getting around it, in the Caribbean context, rum is next to water.
You know, Carnival.
We're going to have to come back and do a special before Carnival so that we can really get persons on a safe sex mindset during Carnival, because yes, drugs and alcohol, and not saying that drugs is, but we know what happens around Carnival, and we indulge a little too much sometimes in alcohol, and our inhibitions are down. Do they have an effect on your libido and your sexual performance?
Let me just say from experience, in the sense of talking to women, I think it might differ from person to person. I say that because I would hear somebody said, you know, the male partner drank alcohol and they just go like they could not have ejaculation. They just go. And it have other time you would hear, oh, they can't. I think it could be, I'm just saying, this is my own way of thinking, or my assumption of this, is that maybe after prolonged alcohol use, maybe that is where you might have a negative effect when it comes to maintaining an erection. Whereas it's somebody who not really normally would drink alcohol, and they might just indulge at this one point in time, and they would just be able to just go without, you know, taking a long time to ejaculate, because I've heard both sides. So that is just my assumption. Maybe this is what is happening at this time, and that is what is happening at another time. So I don't know if doctor have anything else concerning that, but that's...
Yes, but drugs and alcohol, of course, yeah, it does have an effect. For the men, as I said, for women that come and talk to us, they would speak of, you know, if I go to my boyfriend, my husband, whatever, and he indulges a little bit too much, he would come home in the mindset, yes, he wants to do all of these things, but nothing happens. So he might fall asleep, or the erection doesn't last, or he cannot ejaculate or something. So maybe a little alcohol is okay, but when you overindulge, then it kind of kills what is there. You know, and you feel like when you start drinking alcohol, it's a stimulant, but it's actually a depressant. So it doesn't allow you to do all the things that you think you want to do. So when you start drinking it, you're like, yeah, I'm on top of the world. And then after you take too much, you're like, yeah. Yeah, so, you know, and the other thing is, you know, in the Caribbean at large, weed or marijuana is another thing that the young persons indulge in. and they're like, yes, when they smoke the weed. You know, I don't have much experience with that in terms of persons speaking about the weed and all of that, but you know, all of these things do have an effect. I remember when I was at Taylor Hall, UA campus, Mona, and we used to have these parties in the dining hall. And in the dining hall, it's a small little thing, and then they close up all the windows, and some of the guys were smoking all this marijuana, and I'm like, oh yeah, yeah, yeah. And at the end of the night, I don't know what happened.
Is it called hot boxing? I don't remember.
It's called something.
It's called something. Yes.
I don't know if that's the word, but it's called. And I remember my friend at the time dropped me home, and he dropped me home at maybe at 3 o'clock in the morning to my house. I wasn't staying on campus at that time. And I woke up. When I woke up, it was dark. So I said, oh, it's probably 5 o'clock or 6 o'clock. You know, it's not daylight as yet.
Oh, it's the next day.
And then I saw my 2 brothers and my aunt over me, like, you know. And they said, Karima, it's like 8 o'clock in the night. You slept all day. Mm-hmm. And they just basically came over me to be like,
you still living?
Okay, she's alive. From then on, I don't even want to really be beside anybody that's smoking marijuana because. And then the thing is, I had a test to do the following day. So if anybody knows me, so that the party was a Saturday night, the next day was a Sunday, which I did nothing. The test was a Monday. And if anybody knows me, before a test, I am the person that is studying. You know, when they said, you know, you must go to sleep at 6 o'clock in the evening or 8 o'clock and get a good night's rest. That's not me. I studied straight up until the next morning. But for that night, I couldn't stay awake. My aunt just made sure I drink water, get something to eat, and I went straight back to sleep. And the test was at 9 o'clock. I was like, oh my God, I'm going to fail this test, and I'm never going to forgive myself. Because that's when I was trying to get into med school. And I did the test. I walked out of the room. I'm like, I don't even know what I put down on that paper. And then the results came out. I didn't want to look at the results. And guess what? I got the highest grade in the class.
Nurse Myers, Dr. Matthews, thank you again so much for joining me this episode. Really enlightening, really educational. I hope persons take something that makes them feel a little bit better about themselves and open up a bit with their partners when it comes to having a healthy sexual life and just being able to explore who they are, what they like, and knowing what is best. I hope you join me here again next week. Be sure to like, follow, subscribe to all the pages. Continue the conversation. Let's not leave the conversation here in this room. Let's continue the conversation online. Drop me a line if there's something that you want to talk about, if there's something that you want to know. Certainly these 2 ladies will be back and will agree to be back at some point in the future. And as always, we need to talk.